Hello, and welcome to the Health's the Key mini edition, which we like to call Keynotes. I'm your host, Elizabeth Moore. In our June episode, Dr. Hugo Ortega from Montefiore, Einstein in the Bronx explained how lifestyle medicine, treating the whole person, is transforming healthcare. In this keynote, he explains how he uses a technique called motivational interviewing to empower his patients on their health journeys. Drop us a line and let us know what you think.
A lot of lifestyle behavior and modification change is related to coaching and motivational interviewing. And those aren't traditionally skills that are taught in medicine. And so people who do get certified in lifestyle medicine do have to undergo some level of training related to that.
Can you elaborate a little on motivational interviewing? I've heard that in relation to, but I'm not entirely sure what it means.
Of course. Yeah, motivational interviewing is... It's essentially a skill set. It's a very specific skill set where you want to talk to the person, the patient. You want to get them to acknowledge everything that is going on related to the issue, right? So let's say someone is smoking. This is like when we're most often taught about motivational interviewing in like traditional medical training. It's the person smokes, understands smoking is bad for them, but still doesn't want to quit smoking. And so in the motivational interviewing process, we want to figure out why that is. So, what is it about smoking that you like? What do you enjoy about smoking? What is smoking doing for you? What role is it filling in your life? And then also, how is it harming you? Like, what are the downsides to it? And what are all these things that it's affecting you negatively with? And then you want to put them towards the patient. It's like, look, you told me these are the positives and these are the negatives, right? How do those look to you? And most people will start to eventually realize that the negatives are way worse than the positives, right? Like, sure, the smoking makes you feel less stressed and it kind of gives you something to do with your buddies for 5 minutes a day at work, right? But at the downsides of like having poor relations with your wife and, having to change all your clothes because your kids can't stand the smell, right? Like those negatives are pretty bad. And so then we want them to kind of acknowledge the ambivalence that they have towards the smoking or whatever the behavior change in lifestyle, and then helping them to build that intrinsic motivation to change rather than it being external, rather than it being a motivation that it's like, hey, as your doctor, you need to stop smoking, please stop smoking. Or as your wife telling you, hey, you need to stop smoking, it's, I want to stop smoking. Me, the patient, the person, I want to do this for myself. And the only way to really get them to start doing that is through this kind of motivational interviewing where you get them to really acknowledge everything about their behavior,
Right?
why they want it, why they don't want it, and then start to help them realize that they can actually have the self-efficacy and the ability to go ahead and change.
For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.